A couple of years ago, my younger sister was down with meningitis and was admitted at the Benue State University Teaching Hospital, Makodi. Good day, everyone. This is Pharmacist Carb, and today on Pharmacist Carb TV, we have a resident doctor in pediatrics who will be enlightening us more on meningitis. So, doctor, please can you introduce yourself?
Thank you, and good day, everyone. My name is Dr. Otor Victor, a resident in the Department of Pediatrics, Benue State University Teaching Hospital. Thank you.
Thank you, doctor, and thank you for accepting to be today here on Pharmacist Carb TV to enlighten us more on meningitis. So, doctor, please, what is meningitis?
Okay, meningitis can be defined as inflammation of the leptomeninges, and this refers to the layer of tissues that cover the brain. Thank you.
Wow, wow. Thank you for that definition, doctor. So, please, do we have types of this meningitis?
Yes, the types of meningitis can be based on the infectious cause, which
Okay.
would be bacterial meningitis, viral meningitis, and fungal meningitis. We also have parasitic meningitis, drug-induced meningitis, and then tuberculous meningitis has been categorized independently of other bacterial causes because of its unique clinical features. Then also we can classify it whether it's acute, that's less than a month, or chronic meningitis. Thank you.
Wow, wow, wow. I'm really learning today from Dr. Otto Victor. So, doctor, are there things that predisposes one to contacting this meningitis, or what are the risk factors of this meningitis?
The risk factors, we can look at first your geopolitical region. There's a region in the that is called the meningitic belt, for which, should I say, unfortunately now Benue State belongs to the meningitic belt, and it is usually transmitted in the hot, humid time of the year. Also, at the individual level, we look at vaccination. Is this lack of full vaccination or not by fully immunized for age? And then overcrowding for those in boarding schools or in a communal environment where children are crowded together. And then, of course, another child in the neighborhood who has had meningitis as an illness predisposes the other children because it's quite contagious.
Wow.
Yeah, thank you.
Wow, wow, wow. So you can hear from the doctor what predisposes you to getting this meningitis, to try and abide to what he has mentioned. Okay, so please, doctor, what are the symptoms? What are the signs and symptoms of this meningitis?
Okay, there are classical symptoms we usually ascribe. We call them, and they are symptoms of meningeal irritation. So we have a neck pain, we have headache, and then we have photophobia, which can be literally translated as the fear of light.
Okay.
And also we have vomiting, which is described as early morning and projectile vomiting. And then there may be multiple convulsions. And then we also have loss of consciousness and coma. These children may also get loss of consciousness, restlessness, and then coma, depending on the stage of the disease at which the individual is presenting to the hospital.
Wow, wow, wow. Thank you so much. I'm really schooled by Dr. Otto Victor. Please, if you are experiencing or your child is experiencing any of these symptoms that Dr. Otto Victor mentioned, please don't hesitate. Make sure you consult your doctor or the nearest clinic or hospital around you. Okay, so moving forward, doctor, do this meningitis have treatment?
Oh, yes, it does. And the good thing is not just the treatment is available.
Okay.
And we have the antimicrobial agents that can treat meningitis based on the cause.
Okay.
We're looking at. So, but the advice is the treatment also will depend on the underlying cause and the severity. For some, we treat for 5 to 7 days, some in 10 to 14 days, and some may even be as much as 21 days, especially in the newborn age group. So yes, there is treatment for meningitis, and the treatment is available in our health institutions, even the ones you have in the States. Thank you.
Wow, wow. You know, there used to be this saying that prevention is better than cure. So, doctor, what are the preventive measures that one can put in place to avoid contacting this meningitis?
Okay, this is a very, very good question. There are the prevention. The easiest way to look at prevention is to look at the risk factors. So we've talked about the region. So we cannot ultimately change the region we live in, And then even if a child is in boarding school, may not be able to withdraw because he's trying to run away from meningitis. However, there are some risk factors that can be modified. So for example, we can get immunizations up to date, and the good thing is, even for the meningococcal vaccine, there are booster doses of these vaccines, including the pneumococcal vaccines. That brings us to the point of the vaccines that prevent against meningitis. It's simple. This we call them the pentavalent vaccine. That's the one taken at 6 months, 10 months, 6 weeks, sorry, 10 weeks, and 14 weeks. And then the meningococcal vaccine, which is also taken at about 9 months, and some places give it at 1 year. So that's one. Two, early treatment of acute respiratory tract infections, which usually characterized by nasal discharge, what we call catarrh and or flu, and then also cough. So if we see that the respiratory infection has protracted for about 5 to 7 days, this is the time to raise alarm, because they can easily spread from the nasopharynx, that's the back of the nose, to the brain. So it's good to treat them early with the right antibiotics at the right dosage for the right duration. In the event where it's not getting treated on time, especially for those of us who patronize pharmacies and chemist shop, we will need to report at the nearest hospital so that there will be prompt treatment with adequate antibiotics to prevent progression to the meninges, which will now cause meningitis. Yes.
Wow, wow. I'm being really, really schooled today by Dr.
Okay.
Do you have any final advice you can give to my viewers out there?
Okay, the final advice is it's usually sad to see children, because they are the risk group for this because of their immune strength. So it's sad to see children come down with meningitis at this age, when we know vaccines can prevent, and also early and prompt treatment of respiratory tract illnesses can also prevent. However, in the event where these symptoms are still there, please present to the nearest hospital, preferably a tertiary hospital, for prompt treatment, and then ask questions. Always ask your doctor questions when you are not sure, and don't take laws into your hands. Don't resort to harmful cultural practice. Orthodox medicine is good, is safe, and meningitis is a preventable and also a treatable illness. Thank you very much.
Wow, thank you, and thank you, Doctor. I remain from Asiscab, and
I'm Dr. Otor Victor from the
okay.
Department of Pediatrics, Benue State University Teaching Hospital.
Thank you so much, Doctor. So please
My pleasure.
like, share, comment on this video. You may be saving someone out there, and make sure you follow Pharmacist social media handles for more medical updates. Cheers.
Bye bye.